So one of the main pieces to lateralizations and regressions, when I like to think it was over 10 years ago when I started to think about these things, was in order to get as close to as aggressive training as possible, which is the goal. The goal from day one, you're being wheeled out of the OR, how can you get as close to aggressive training as possible, is you have this companion concept that says start at the finish. I need you to write down, whatever you do, what would the program be if this individual had no physical limitations? I know they're on the gurney, and I know they're getting wheeled out after somebody just cut out a piece of bone out of their spine, okay? But if that didn't happen, and they were the same age, and the same fitness level, the same training age, what would you be doing? What would your list of exercises be? Not the rehab exercises, not the physical therapy, not everything in between. What would you be doing with them if it was just ass-kicking time? That's it. Okay? Now, lateralizations and regressions is how you start to bridge and get as close to over here as possible. You then were required to look at everything that you put down into that program, and you had to answer the question, why? I have some workbooks that I kind of made on Excel to help people understand this. And again, it works very, very easily in very acute forms of post-surgical rehab because you simply can't do every exercise. But I need you to think about it, and if you can tell me why you're doing a particular exercise like a barbell back squat, you're gonna tell me something like I am doing that for bilateral lower body strength. I am doing that for knee dominant strength. I'm doing this for supporting rate of force development for vertical jump. There's a lot of different answers that you can provide for anything that's on your list. And we already know that they can't do those things right now. Doesn't mean they can't do them forever. But now, when we can identify what are the physical limitations, not all the time, but most of the time, we can pick a different exercise to do the same thing. So if I tell you lower body strength, back squat is not the only exercise on earth. You are allowed to suggest that it's the best choice. You are allowed to say that that's the exercise you want to do. You are not allowed to say it is the only exercise on earth to deliver lower body strength. What else can you do to deliver lower body strength? Let's say when your knee hurts, when you are in a knee dominant pattern like a barbell back squat, you can deadlift. I'm pretty sure deadlift is very, very good for lower body strength. Clearly, the muscles that are being targeted are different. The angle of your spine is different. Maybe where you carriage the bar is different, but you're trying to get as close to it. So now, clearly, people that have knee surgeries are probably going to deadlift or get something to like an RDL or a straight leg deadlift probably a lot sooner than they'll be burying even a body weight or low load goblet squat, simply based on what the knee surgery did. So lateralizations is something that over the next couple weeks, you're gonna see my business partner, Kyle Balzer _DPT, you're gonna see him being very, very specific in talking about what are the lateralizations that you can use under certain circumstances. I'm coming at it from a little different angle here. What is your program? You have to tell me what your program is. I can't tell you where to run lateralizations until you tell me what you want to do. And if I go back those 10 years, part of what I wanted to be able to do was to get you to actually care about your program and not just copy something, even though that's not a terrible way to start. I need you to tell me, like, what is it that you're trying to accomplish? And then lateralizations and regressions can help you not only work together with other professionals, more importantly, get you as close to fitness as possible.